What's up mga kababayan? This is Doc Chris here, your online family doctor, and making medicine easy for you to have a healthy life.
For every home, a heart to guide. Filipino strength standing by your side. Through every mile, through every fight, your family's light burning bright. Family physicians give life a healthy life.
Nag-post si Doc Willie Ong, I think just yesterday or kagabi, about an update tungkol sa kanyang karamdaman. Well, if you are not yet familiar, Doc Willie Ong is a prominent doctor on social media that is advocating good health education, patient education sa mga kapwa natin mga Pilipino. He is currently battling sarcoma stage 4 and has been undergoing therapy, chemotherapy, and is even managed in Singapore, di ba? Sa atin, syempre sa ating mga kababayan, it's very hard for us to have these types of conditions, especially cancer. Kasi napakahirap isipin na kung magkaroon ka ng cancer, parang helpless ka na. Hindi mo alam kung saan ka napupunta. And we see a lot of patients like this, even sa mga bata pa, or mga elderlies na nagkakaroon ng late diagnosis, and they have a lot of things in their mind. And minsan kasi kapag he talks about how he experienced his management for last year, di ba alam mo, na tumakbo siya or planning na tumakbo for senator during the past midterm elections. Unfortunately, those dreams and aspirations were put into pause. I'm not sure kung tutuloy pa rin siya, pero syempre, priority pa rin niya ang healthcare. For his experience having sarcoma stage 4, may mga tips siyang binigay. Sabi nga niya, those are 10 tips for you if ever you are feeling features of, let's say, a malignant condition or chronic disease. Doon sa mga binanggit niyang tips, more likely parang related lang sa karamdaman niya. Pero most of the time, ang mga patients with cancer would also present with some similar features. So, daanan natin yung mga 10 tips na binanggit niya. Let's go to number 1. Number 1 was back pain. The back pain was a symptom. The first symptom daw na naramdaman niya, and at the same time, nagkaroon din siya ng increased fluid buildup. So, not all cancers will start that way. That depends on kung ano yung uri ng cancer na meron yung pasyente. Let's say for example, lung cancer. Lung cancer can present with weight loss, biglang pumayat, nangayayat. Pwede rin yung nagkaroon ng pag-uubok, tapos mayroong dugo. So maraming differentials yan. If may mga symptoms kayo na abnormal, huwag magdalawang isip na magpatingin agad sa doktor. Okay? And next, number 2, sinabi niyang advice, ultrasound is not enough. Yes, actually, ultrasound is just part of the screening procedures in certain conditions. Mas nagiging mahalaga nga ngayon ang mga higher or advanced forms of imaging that includes contrast CT scans, including MRIs. Okay? And syempre, the most definitive way, if lalo may bukol, you have to push through with a biopsy kung available at saka accessible yung bukol. Now, pangatlo, sabi niya dito, huwag magtago sa doktor. Kasi most often, ang mga patients natin that can be suspected to have cancer, if nabanggit pa lang ng first doctor niya or ng screening niya na may possibility na bukol to or cancer, hindi na bumabalik yung pasyente. Hindi na parang tago na sa bahay, ayaw niya nang isipin, kung sakaling nalaman niya, baka mas lalong lumala, huwag kayong matakot. The reason why we did the screening, or the reason why nagpatingin ka is merong symptoms kang nararamdaman. And kung pababayaan mo lang yun, mas lalala at lalala ito sa mga susunod na araw na hindi mo siya pinapansin. Kaya mas mainam na magpatingin ka sa doktor agad. Pang-apat na binanggit niya, kung nagdududa ka pa rin sa mga symptoms mo, it's always okay and safe to have a second opinion with another doctor. Pakikita naman natin kung ano yung opinion ng first doctor mo at saka yung second doctor. If they match or nagtugma sila, it will increase the chance for you to realize na we have to do something about your health or yung karamdaman mo mas kailangan na ng atensyon. Now, another thing with that is syempre Pag naisip mo pala yung cancer, ay mahal na ang gamutan. Ang mahal ng chemotherapy, ang mahal ng mga procedures and treatment, baka hindi ko kaya or di ko kaya ng bulsa. Right now in the Philippines, even though we have a lot of challenges, especially in PhilHealth, there have been advances in cancer treatment, especially in the coverage for cancer treatment in the country. May mga cancer centers na pwede mag-cover for treatment of a lot of types of cancer. So huwag kayong matakot. Go to any government cancer center or cancer institute na meron sa North, sa NCR, Visayas, and even Mindanao. Meron pa rin yan. Magkakaroon. At alam ko meron yan. Sa amin dito sa North meron. Okay, ano pa? Pang-anim, if sinabi ng doktor mo, sabi ni Doc, chemo or operation, pwede ka pa rin naman mag-ask of second opinion, pero as much as possible, pumayag ka na kapag binanggit na itong mga ito. Treatment is always important to be started immediately upon the recommendation of your doctors. Kasi kung pinapabayaan natin ito from another day, susunod na araw, susunod na linggo, yun na dapat ang nasa mindset natin. Pwede ka pa rin naman mag-ask ng second opinion, sabi nga ni Doc, pero it's all just for the reassurance. For treatment, it's always important that we start treatment immediately. Pang-pito, okay, piliin, okay, sorry, naipit ako. Kapag nag-start ka na sa treatment for your cancer, it's always important that you rest or magpahinga. Ang pagpapahinga is also one way for your body to recover. Because cancer treatment like chemotherapy, radiotherapy, it burns a lot of calories. It also burns a lot of the nutrients that you need for your body to live, kumbaga. So, talagang may exhaust ka. So, if you have the chance to rest, magpahinga, matulog, after treatment, during treatment, do so. Okay? You can also, syempre, wind down and read a book para during treatment. So that's always an important aspect of if you are going treatment or if you are undergoing treatment, you have to take care of yourself as well. Now, pang-walo na binanggit ni Doc, kumain ng gusto. There are challenges during times of cancer treatment. Sabi nga ni Doc Willie, yung mga kinain niya during the first few phases ng kanyang treatment, parang lasang bakal. And it's true. Dysgeusia or the loss of taste or hindi na maganda yung panlasa happens during cancer treatment depending sa anong protocol yung tinitake mo. May mga platin gano'n na treatment na chemotherapy that can really destroy your appetite, and kapag di ka na wala ka nang ganang kumain, wala na, itutulog mo na lang. Pero as much as possible, try to eat para hindi ka magkaroon ng stress ulcers. Now, pang-siyam, kailangan tanggalin ang sakit. Now, ang habol kasi natin dito is our goal should be focused on treatment and even quality of life. Cancer therapy depends on kung anong stage ka na na-diagnose. If there is a possibility na gagaling ka, we take advantage of it as much as possible kung available siya. If, let's say, for example, stage 4 or latter stage na siya, ang main goal naman kasi natin dyan is quality of life and to give you the proper life that is fitting for a person, for a human being, even if you have a stage 4 cancer. So, lastly, pang-10 na nabanggit ni Doc, magdasal. Yes, religion is always an important aspect of human civilization and also part of living. If you have faith, your faith can also be one thing that can hold you up during times of distress, during times na nanghihina ka na. Just look up to your own religion, your own faith. Kung ano yung nararamdaman mo, try to meditate, try to talk with the Almighty, with God. Okay? He will always listen to you in those situations, and it will try you, kumbaga, might have clarity eventually to move forward and push towards your treatment. And be positive and be optimistic sa mga ganong sitwasyon. Cancer is tough. Cancer is a disease that is, well, we don't want to have cancer. No one does. It happens from time to time to anyone. It could happen to you. It could happen to me. It could happen to anyone. Kumbaga. But we have to face it, and syempre, we have to keep living. And yes, as a family doctor, we have to reassure our patients that our treatment and our decisions in managing these types of disease is important na we have to preserve our humanity and the quality of life that we deserve. That includes giving the proper treatment, providing the proper decisions, especially if let's say we want to decide kung kailangan ka nang mag-opera, kailangan ka nang mag-start ng gamutan. Now, a doctor, like a family doctor, can help you, process those decision makings. If let's say, for example, hirap ka talaga, and these 10 tips na binigay ni Doc Willie, yes, they are also helpful. But if you want to talk it out with your family, with your attending physician, and within also siguro kung na-refer ka sa hospice and palliative care, a group discussion about your case is always important, and it's always accepted with the field of family medicine, kumbaga, no? And yes, I hope for Doc Willie, he gets a speedy recovery. Siyempre, he is also being a supportive husband for his wife, Doc Kriziaoumo, who is also diagnosed with breast cancer, invasive ductal carcinoma, which is considered to be noted to be a good prognosis. Pag sinabing good prognosis, maganda naman ang outcome niya. Just as long as she follows the proper protocols for breast cancer. And ganda lang naman yung video ko. I really admire Doc Willie for this. And we, as first generation doctors, really admire his work ethic and his advocacy in health educating patients, especially our Filipino patients. Again, if you are new to the channel, please give it a like, give it a thumbs up, or share it also. We always encourage, and we are very happy if you are dropping by and seeing this video, especially for us. No? Again, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life.